So you're sensitive to light or sound. You may feel nauseous, and you may have pain on one side of your head. You try lifestyle changes and they work, but not to the degree that you desire. But have no fear, because in this video, we're going to discuss over-the-counter medicines you can take for migraines. And make sure you watch until the end, as I'm going to outline what products are available and in what order you should use them. So stay tuned. Greetings, health experts. This is Brandon E, your Pharm.D, and welcome to my YouTube channel. In our last video, we talked about lifestyle changes that we can make to help with migraines. We talked about getting enough sleep. We talked about what foods to avoid. And then we talked about one surefire way to identify your triggers for migraines. So make sure you check that video out as well. But what are some over-the-counter medicines we can take for migraines? We're going to discuss 5 treatment options, the first of which is acetaminophen. And acetaminophen is the active ingredient found in traditional Tylenol. While technically it's not FDA approved for migraines, acetaminophen has been shown to be effective for mild to moderate cases of migraines. At a dose of about 1,000 milligrams or 2 500 milligram tablets, it's been shown to be effective. But if you want to take acetaminophen, be cautious if you have liver disease or if you drink 3 or more alcoholic beverages a day. The next product we're going to talk about is aspirin. And aspirin is an anti-inflammatory medicine, and it has also been shown, like acetaminophen, to be effective in mild to moderate cases of migraines if used alone. But keep watching, as I'm going to talk about a more effective way to use aspirin. The third product we're going to talk about is naproxen. And naproxen is available in both prescription and over-the-counter strengths. And in the over-the-counter formulations, you may see it under the brand name Aleve. And like aspirin and ibuprofen, which we're going to discuss in a minute, Aleve or naproxen is an NSAID. It's a non-steroidal anti-inflammatory drug. And naproxen may be beneficial if you have a migraine, but it's not one of the first medicines I would reach for. I would use some of the other medicines as they have better data behind them. The next product we're going to talk about is ibuprofen. And ibuprofen, again, is a common over-the-counter product, and it's marketed under the brand name Advil Migraine, specifically for migraines. And this medicine has been shown to be effective in mild to moderate cases, and it helps with migraine pain and then associated symptoms like nausea and sensitivity to light and sound. And this can be seen at doses of both 200 and 400 milligrams 2 hours after administration. And again, ibuprofen has been shown to be effective in mild to moderate cases, but if you have more severe migraine symptoms and it's worked for you before, then feel free to use it again. Now, the last product I'm going to talk about, and again, I just mentioned a few minutes ago of how to use aspirin as a more effective way, is the combination of aspirin, acetaminophen, and caffeine. And now you're probably thinking, why would I take a product with caffeine? Won't caffeine make my migraine worse? As caffeine can cause jitteriness, it can increase your heart rate, increase your blood pressure. Why would I take something with caffeine if I have a migraine? Caffeine actually enhances the effects of aspirin and acetaminophen when all 3 are combined together. So if you take any one of the medicines in comparable doses, caffeine, aspirin, and acetaminophen, the combination of the 3 has shown to be more effective than using any one alone in comparable doses. And this agent is found under the brand name Excedrin Migraine. Again, it's aspirin, acetaminophen, and caffeine. And this combination, in my opinion, is the strongest over-the-counter medicine that you can take for migraines. But be sure when taking this product, you want to limit your caffeine intake, as taking this can be equivalent to drinking a cup of coffee. When using the above mentioned products, make sure you follow the directions on the label and do not use the products more than directed, as they can lead to medication overuse headaches or rebound headaches. This is a condition caused from overuse of medication for headaches, leading to prolonged and worsening of your headaches or migraines. If you're needing to use the over-the-counter migraine medicine several times a week, you may want to consult your doctor to be further evaluated, as you may need a prescription medicine. So now let's put everything together. Let's say you're having a migraine or you're at risk of having migraines. What should you do? Number 1, you should practice the lifestyle changes we talked about to prevent and treat migraines. And again, if you haven't watched that video, go watch part 1. And then if the lifestyle changes aren't enough, you want to jump to the over-the-counter medicines. Now, when taking the over-the-counter medicines, you want to try the product 3 times. If 2 out of the 3 times the product doesn't work, then that medicine is considered a failure and you want to move on to the next medicine. So the first product I would try is a product with acetaminophen or aspirin alone. I would try a single ingredient product and then work up to more powerful products later on. So again, try a product with acetaminophen or aspirin first. And if those don't work, I would then go to ibuprofen or Advil migraine. If Advil migraine doesn't work, the last product I would use would be Excedrin migraine, or the combination of aspirin, acetaminophen, and caffeine. Or let's say you're having real severe migraine symptoms, or let's say you're on a prescription migraine medicine, and let's say your prescription migraine medicine is out of refills, or let's say you're on vacation and you forgot your prescription medicine and you need something quick, I would jump straight to Excedrin migraine, or aspirin, caffeine, and acetaminophen, as that's the most powerful over-the-counter medicine for migraines. So again, to get the best treatment, you want to combine the lifestyle changes with the over-the-counter medicines. If you have any questions, let me know in the comments, and be sure to subscribe to the channel. This is Brandon E., your Pharm.D. Remember to drink water, and hope this video helps.